That stiffness when you first get out of bed each morning. The ache that begins in your lower back and gradually spreads into your hips and thighs as the day goes on. The muscle spasms that strike without warning, sometimes severe enough to stop you mid-step. That constant feeling that your back is always just one wrong movement away from giving out completely. You have probably been told this is arthritis, disc degeneration, or simply the cost of growing older. But I want to share something with you that permanently changed the way I approach back pain in my senior patients. 2 patients, same age, 67, same MRI findings, moderate lumbar disc degeneration, mild facet arthropathy. Both had been told by previous physicians that their back pain was a natural consequence of aging and that managing the condition, not curing it, was the only realistic goal. Patient 1 was placed on anti-inflammatory medication and referred to physical therapy. 6 months later, there was modest improvement, but daily pain remained, and physical activity was still limited. Patient 2 was different. I ordered one specific blood marker that most physicians never check in back pain cases. The result came back severely deficient. I corrected that deficiency over 12 weeks. 6 months later, that patient's back pain had decreased by more than 60%. No surgery, no injections, no ongoing medication. The structural findings on imaging were identical, but the outcomes were completely different. What magnesium does in your back muscles. The reason comes down to this. The muscles of your back, particularly the deep stabilizing muscles that hold your spine in alignment and engage with every single movement you make, require one specific mineral to function correctly, to contract fully, to release completely, and to avoid the chronic low-level tension that is the single greatest contributor to ongoing back pain in adults over 60. When that mineral is deficient, which it is in an estimated 70% of adults over the age of 60, those muscles cannot fully relax. They remain in a state of partial contraction. They fatigue rapidly. They go into spasm at the slightest trigger. And the pain they produce gets labeled as arthritis or disc degeneration, when the actual underlying cause is a correctable nutritional deficiency that is sitting right there in your blood work, waiting to be identified. That mineral is magnesium. The reason it is almost never identified as a contributing cause of back pain is that the standard blood test for magnesium misses up to 70% of true deficiencies. You can be severely depleted in the muscles and tissues of your back, while your blood test returns a completely normal result. My name is Dr. Thomas. I have spent more than 20 years in medicine with a focus on senior health. Today, I am going to give you a complete picture: why magnesium deficiency causes back pain, how to test for it accurately, and exactly how to address it in a way that is appropriate for the aging body. Mechanism 1. Muscle contraction and relaxation. Let me begin with the foundational question. What exactly is magnesium doing inside your back muscles, and why does its absence lead to so much pain? Magnesium is the 4th most abundant mineral in the human body. It participates in more than 300 enzymatic reactions, ranging from energy production to DNA synthesis to protein formation. But when it comes to understanding back pain, 3 specific roles are most important. The first is muscle contraction and relaxation. Every muscle contraction in your body, including those of the deep spinal muscles that stabilize your vertebrae, requires both calcium and magnesium. Calcium initiates the contraction. Magnesium facilitates the relaxation. This balance between the 2 minerals is essential for normal muscle function. When magnesium is insufficient, the relaxation phase of muscle activity becomes impaired. Muscles that should fully release after contracting instead remain in a state of partial tension, a low-level, sustained effort that the brain does not register as intentional movement, but that the muscles experience as continuous, exhausting work over the course of hours and days. This sustained partial contraction produces the deep, persistent aching that so many seniors describe as their back pain. Not sharp, not stabbing, just a constant, heavy, draining ache that never fully goes away. This same mechanism explains the sudden, severe muscle spasms that are so frequently reported by seniors with back pain. A muscle that is already chronically partially contracted, already operating near its fatigue threshold, can tip into full protective spasm in response to a very minor trigger. Bending slightly too far, twisting to reach something, or standing up too quickly. The muscle that should have been relaxed and ready to respond normally is instead already tense and fatigued, and it crosses into full spasm with almost no provocation. Mechanism 2. NMDA receptor and nerve sensitization. The second role magnesium plays is in nerve signal regulation. Magnesium acts as a natural calcium channel blocker at the level of the nerve cell membrane. It occupies the NMDA receptor, a receptor on nerve cells that responds to pain signals, and physically prevents the excessive calcium influx that would otherwise cause the nerve to fire pain signals too easily and too intensely. This process is known as central sensitization, a state in which the nervous system becomes over-responsive to pain signals, amplifying them beyond what the actual degree of tissue damage would justify. Magnesium's presence in NMDA receptors is one of the primary natural mechanisms that prevents this sensitization from developing. When magnesium is deficient, the NMDA receptors lose this protective blocking effect. The nerves of the back become hyper-responsive. Signals that should register as mild discomfort are amplified into significant pain. Movements that should be painless become uncomfortable, and the back feels fragile, overly sensitive, and unreliable, in a way that far exceeds what the structural findings on imaging would predict. Mechanism 3. Substance P and inflammation. The third role involves inflammation regulation. Magnesium deficiency directly promotes inflammatory activity. It increases the production of inflammatory cytokines, particularly substance P, a neuropeptide that both amplifies pain signals and drives tissue inflammation. Substance P is one of the primary contributors to the inflammatory environment surrounding spinal discs, facet joints, and the paraspinal muscles that line the spine, and it is a key driver of chronic back pain. When magnesium levels are adequate, substance P production is suppressed. When magnesium is deficient, substance P rises, and the inflammatory environment within back tissue intensifies significantly. Why 70% of seniors are deficient. Now I want to explain why this deficiency is so widespread among adults over 60. Because most people assume that a reasonably balanced diet should provide sufficient magnesium. For seniors specifically, that assumption is largely incorrect for 3 distinct reasons. The first is reduced dietary intake. The richest food sources of magnesium, dark leafy greens, legumes, nuts, seeds, and whole grains, are foods that many older adults consume less frequently due to changing preferences, reduced appetite, difficulty chewing, or decreased dietary variety. Large dietary surveys consistently show that the majority of older adults fall meaningfully short of the recommended daily magnesium intake from food alone. The second reason is impaired absorption. Magnesium absorption from the gastrointestinal tract declines with age as stomach acid production decreases. Proton pump inhibitors, medications commonly used for acid reflux, significantly worsen this problem. Research shows that long-term PPI users have notably lower magnesium levels, and that severe magnesium depletion requiring hospitalization occurs more frequently in this group. Diuretic medications, widely prescribed for blood pressure and heart conditions in older adults, cause meaningful magnesium loss through the urine. And diabetes or prediabetes, both highly prevalent after age 60, are associated with increased urinary magnesium excretion linked to elevated blood sugar levels. The third reason is the inadequacy of standard testing. The serum magnesium test, the one your doctor typically orders, measures the magnesium circulating in your bloodstream, but only approximately 1% of the body's total magnesium is found in the blood. The remaining 99% resides inside cells and tissues, primarily in muscle, bone, and organ tissue. The body maintains blood magnesium within a narrow range by drawing on tissue stores when blood levels begin to drop. This means your serum magnesium result can remain within the normal reference range even when your muscles and nerves are significantly depleted. The more accurate measurement is the red blood cell magnesium test, also referred to as intracellular magnesium, which measures magnesium inside red blood cells and provides a far more reliable picture of what is actually available to your muscles and nerves. This test is widely available but almost never ordered as a routine part of back pain evaluation. If you ask your physician specifically for a red blood cell magnesium test rather than the standard serum test, you will receive a much more accurate assessment of your true magnesium status. Frank's case study. I want to tell you about one of my patients, Frank. Frank was 71 years old when he came to see me, and by his own description, he had reached the end of his rope. He had been dealing with severe lower back pain for 6 years. He had consulted 3 different orthopedic surgeons. He had undergone 2 MRIs, 2 separate rounds of physical therapy, a course of epidural steroid injections, and more anti-inflammatory medication than he could accurately recall. His most recent surgeon had recommended spinal fusion surgery, and Frank had decided to seek one more opinion before proceeding. When I reviewed his records, the first thing I noticed was that in 6 years of treatment by multiple specialists, not one had ever checked his magnesium, not his serum level, not his red blood cell level, and not his dietary intake. His MRI showed moderate disc degeneration at L4-L5 and L5-S1, which is common in men his age and present in a significant proportion of men that age who experience no back pain at all. His orthopedic findings were real, but they were not extraordinary. I ordered a red blood cell magnesium test. His result came back at 4.1 mg per deciliter, well below the optimal range of 5.5 to 6.5. He was severely depleted at the cellular level. His serum magnesium, by contrast, read 2.1, technically within the normal range, which is precisely why it had gone undetected for years. I started Frank on magnesium glycinate at 400 mg taken at bedtime, along with dietary modifications to support ongoing magnesium intake. I also recommended transdermal magnesium oil applied directly to his lower back muscles twice daily, a method that bypasses gut absorption entirely and delivers magnesium directly into the underlying muscle tissue. At his 6-week follow-up, Frank reported a meaningful reduction in nighttime back pain. The muscle spasms that had been waking him were occurring less frequently. At 12 weeks, he described his overall pain level as reduced by approximately 50%. At 6 months, Frank canceled his surgical consultation. He told me it was the first time in 6 years that he genuinely felt he might get his life back. Frank still has disc degeneration. That has not changed and will not change. But the debilitating, life-limiting pain, the kind that had led a surgeon to recommend spinal fusion, was being driven primarily by severe magnesium depletion in the muscles and nerves surrounding that degeneration. Correct the depletion, and the pain responds in a way that no surgical procedure could have achieved. The practical protocol and closing. Now let me provide the complete practical protocol. Exactly what to take, how much, when, and in what form. Because the form of magnesium matters considerably, and most people are currently taking the least effective option. Many forms of magnesium supplement exist: magnesium oxide, citrate, glycinate, malate, threonate, and chloride. They are not equally effective, and they do not all produce the same results in the body. Magnesium oxide is the most common and least expensive form, found in most standard multivitamins. Its bioavailability is very poor. Only around 4% is absorbed from the gut, making it largely ineffective for correcting deficiency in muscles and nerves. Magnesium glycinate is the form I recommend first for back pain specifically. It is highly bioavailable and efficiently absorbed. The glycine it is bound to carries its own muscle-relaxing and sleep-supporting properties, which complement magnesium's effects on back muscle spasm and nighttime pain. The recommended starting dose for seniors with back pain is 300 to 400 ml of elemental magnesium as glycinate, taken at bedtime. Bedtime is ideal because the muscle-relaxing effect is most beneficial during sleep, when the back muscles are free from the demands of upright activity. and because the glycine component supports deeper sleep, during which tissue repair takes place. Magnesium malate is the preferred option for a daytime dose. It is less sedating than glycinate, and the malate component supports energy production within muscle tissue, which helps reduce the fatigue and soreness that result from chronically tense back muscles. Transdermal magnesium, in the form of magnesium chloride oil or lotion applied directly to the skin over the lower back, bypasses gut absorption challenges entirely. The magnesium is absorbed through the skin and delivered directly to the underlying muscle tissue. This approach is especially valuable for seniors with digestive issues or those taking medications that reduce gut absorption. Apply it to the lower back and hips after a warm shower, when the skin is most receptive, twice daily. One important caution: magnesium supplementation can cause loose stools or digestive discomfort if the dose is too high, particularly with citrate or oxide forms. Glycinate is the gentlest option for the digestive system. Begin at the lower end of the dosing range and increase gradually over 1 to 2 weeks. If loose stools occur, reduce the dose accordingly. For seniors with kidney disease, please consult your physician before beginning magnesium supplementation, as impaired kidney function can allow magnesium to accumulate to unsafe levels. To bring everything together, chronic back pain after 60 is driven not only by structural degeneration, which is common, frequently painless, and not correctable through nutrition, but also by magnesium deficiency that produces 3 specific correctable processes: chronic muscle spasm from impaired relaxation, central sensitization from reduced NMDA receptor protection, and elevated substance P-driven inflammation. 70% of seniors are deficient. The standard serum test misses most cases. The red blood cell magnesium test is the accurate measure, and magnesium glycinate at 300 to 400 mg at bedtime, combined with transdermal magnesium oil applied to the lower back, represents the most effective correction protocol for the muscles and nerves directly involved in back pain. Frank canceled his spinal fusion, not because surgery is never appropriate, but because his pain was not primarily a structural problem. It was a nutritional problem that had gone unrecognized for 6 years, while increasingly aggressive interventions were recommended. Before agreeing to any invasive treatment for your back pain, please ask your physician for a red blood cell magnesium test. It is a simple blood test. It is inexpensive, and it may identify a correctable cause of your pain that has gone undetected for years. If this video gave you something genuinely useful today, please take a moment to give it a thumbs up. Leave a comment below sharing whether you recognized your own experience in what was described, and share it with someone you know who is living with chronic back pain and has been told it is simply a part of aging. You may be handing them the piece of information that changes everything. Subscribe to this channel for weekly senior health videos that are honest, research-based, and always practical. I am Dr. Thomas. Thank you for watching. Your back has been trying to tell you something. Now you know what to do about it.